talking about the climate change and the public health in Zambia. The health sector in Zambia has compulsorily exhibited its vulnerability to the extremes in the weather patterns. Droughts and floods are becoming more commonplace occurrence in Zambia, and these climate events have persistently resulted in the increased morbidity and mortality levels among the Zambians due to the outbreaks of the diseases such as cholera, dysentery, and malaria. Climate change is projected to exhibit these types of vulnerability. Consequently, there is need to understand the nature and character of climate health interactions so as to ensure effective climate change adaptations. With me in the studio today, we discuss the climate change and it relates to the public health in Zambia. Is PMRC researcher Mr. Kaputo Chiewele. Good afternoon and welcome to the program, sir.
Good afternoon, Boniface. Thank you for having me.
How you doing?
I'm doing well, thank you.
How's the weather outside? I haven't been there for some time now.
No, the weather is very nice.
That's what we're talking about, the pattern, the weather patterns. That's what we're talking about. Okay. First thing first, can you just explain to those who may not know what climate change is?
Okay, simply put, climate change can be defined as a long-term shift in global or regional climate patterns. Often when this term is used, it refers specifically to the rise in global temperatures from the middle of the 20th century to present day.
Mm-hmm. Right, fantastic. Now, why should climate change be taken seriously in relation to the public health?
Okay, it is worth noting that Zambia has a population of approximately 19 million people, currently saddled with a large burden of disease. So this burden is incessantly robbing the country of millions of productive hours, with over 8 million clinical cases per annum of malaria, diarrhea, respiratory infections, and other communicable but avoidable illnesses, according to a 2020 report by the World Health Organization. The situation is further worsened by the increased frequency and magnitude of climate variability in recent years. So of utmost concern, these climate anomalies are able to stifle or even reverse improvements in health by increasing illnesses and deaths. So it's unlikely that Zambia will meet most of the climate and health-related sustainable development goal targets by 2030 under such conditions. The high vulnerability of the health sector in Zambia to the adverse impacts of climate variability and climate change is rooted in the widespread prevalence and proliferation of health risk factors within the population. These factors include inadequate health care facilities and personnel, extensive poverty, poor water supply and sanitation, and poor nutrition coupled with food insecurity.
Mm-hmm.
So Zambia can begin to reverse the deteriorating health trends in the population by aggressively implementing climate-informed policy interventions. This implies that investments are required to start the process of seriously mainstreaming climate risk reduction and adaptation into plans and programs in the health sector.
Okay, so now what has Zambia's policy response been so far to the impact of the climate change in the public health?
Zambia's national health policy, developed in 2012, has a cross-sectoral strategic plan designed to improve the health status of Zambians by taking into consideration key issues at both national and international levels, such as health systems strengthening, gender equality, globalization, and of course climate change. One of the key policy measures outlined in this policy is to strengthen the country's capacity to respond to the effects of climate change. Secondly, Zambia's national climate change policy developed in 2016, acknowledges the fact that climate impacts add to the strain already felt by the public health sector in Zambia. So this policy further acknowledges that rising temperatures and changing precipitation patterns are responsible for the expansion of disease vector habitats. For example, diseases like malaria are spreading to areas where they were not prevalent before. Outbreaks of bilharzia have also been reported during past floods, while diseases like cholera, typhoid, and dysentery have occasionally reached epidemic proportions in the face of climate change. Further, waterborne diseases have become more widespread as safe water becomes inaccessible, or in cases of flooding. Sanitary infrastructure in many areas is inadequate or lacking, and such a situation has favored the spread of deadly diseases that are linked to rising temperatures, high rainfall, and inadequate waste disposal facilities. The National Climate Change Policy thus advocates that climate change-related public health plans and interventions are heavily promoted.
Right. Yeah, we're still talking to the researcher, that's Mr. Kaputo Chiewele, from the climate change and health, public health in Zambia, rather. Now, do you have any policy recommendations concerning what Zambia should do where the public health and climate change issues are concerned?
Yes, I do. Firstly, in recognition that the adverse impacts of climate change on human health in Zambia are real, there is need for the Ministry of Health to further integrate climate risk management and adaptation measures into national health strategic plans. Secondly, the supply and delivery of medical drugs by the Ministry of Health to health facilities should be synchronized with seasonal fluctuations of diseases. This will eliminate stockouts of drugs during peak transmission periods when they are critically needed. Thirdly, the Ministry of Health, local government, NGOs, and other stakeholders must urgently embark on vigorous information and education campaigns on the utility of insecticide-treated nets for malaria prevention. This should occur in riverine communities where these subsidized nets are being wrongly diverted for catching fish. Fourthly, climate-informed interventions should not focus only on malaria, but must also include other climate-sensitive diseases that are exerting a significant death toll on the Zambian population. Fifthly, Zambia requires a multidisciplinary capacity for research on the effects of climate change on human health. The Ministry of Health can incorporate this capacity building component into various disease surveillance and response programs. Also, there is need for government, cooperating partners, NGOs, and other stakeholders to take a multi-pronged approach to improving rural health by implementing community-based activities aimed at improving incomes, water supply, sanitation, and food security simultaneously. Seventhly, it is essential to conduct community-based vulnerability and adaptation assessments of the health impacts of droughts and floods. Eighthly, there is need for more specific studies focusing on the influence of climate variability and other health risk factors on the morbidity and fatality rates associated with malaria, respiratory illness, and diarrhea diseases, including dysentery and cholera in Zambia. And lastly, there is need for multidisciplinary research to understand the various pathways through which floods and droughts affect human health and well-being.
That's right. I think I've learned one or two things here. Let's hope the listeners out there as well, you've gotten one or two like I did. Mr. Kaputo, just to finalize or to wind up our discussion this afternoon, do you have anything that you want to share with the listeners out there?
Okay, in conclusion, I would like to reiterate that while strides forward have been made in the health sector with regards to climate change issues in Zambia, we remain vulnerable to the vagaries of climate variability, and hence immediate and urgent adaptation measures are needed if the health targets of the Sustainable Development Goals are to be met on time. This implies that Zambia must strive to further mainstream climate risk reduction and adaptation into national health strategic plans and programs. So let me end by saying that PMRC has done a lot of research around climate change, so please feel free to visit our website for more information.
Right, Mr. Kaputo, thank you so much for coming through on the show this afternoon, rather.
Thank you for having me.
All right.